When you have chronic diseases, changes in climate can be very, very harmful and can lead to death.
My name is Katie Tomberlin, and I'm from Carteret County. This is Community Rising, Shoreside's environmental stories, broadcasting from the Working Narrative Studio. Coming up next are stories from coastal North Carolina.
Hi, I'm Kayla Gilliams, and I'm a reporter for Community Rising. When you think about climate change, you probably think about the impacts it will have on the environment. But one of the most worrying aspects of climate change is the impact it can have on community health. In this episode, I talked with Marian Johnson-Thompson about the potential of climate change to worsen the already existing health disparities in North Carolina.
I am a trained molecular virologist. My first work was in higher education, where I taught virology as well as engaged students in breast cancer research. I did that for about 24 years, and I was recruited to the National Institute of Environmental Health Sciences, and part of my portfolio addressed health disparities. And it was my first time to learn about the environmental justice movement. Health disparities and environmental justice are so closely connected. And as I was really focusing on these two subjects, the climate change worldwide initiative became popular, and it was very interesting to see how climate change impacts environmental justice communities, as well as it plays a big role in health disparities. The health disparities in North Carolina are very serious. For example, we are in the stroke belt, where you find a higher percentage of minorities and low-income people suffering to a greater extent with stroke. That also is impacted by climate. But in addition to stroke, we're really talking about heart disease, chronic lung diseases, those issues which tend to be chronic. When you have chronic diseases, changes in climate, especially extreme climate changes, can be very, very harmful and can lead to death when the environment is overheated. We find during the hottest days in the summers, which are getting hotter as a result of climate change. Within low-income and minority communities, individuals don't have access to air conditioning within their homes. And so often, individuals don't have transportation and are forced to walking in very hot climates to get to their jobs. It also impacts the ability of, let's say, children to play outside, because of the terrible heat. So it has an impact on the social environment as well. But then healthcare has another little piece to it because of racism within the healthcare system. I'm here in Durham, North Carolina, and a few years ago, there was a study that came out of Duke Medical School that actually showed that Black patients who presented with heart conditions were not given angioplasty, which is often what is provided to white patients, because the idea was that Black patients would not follow protocol, and so it was no need to offer this treatment to them. When you speak to people who are living in these kinds of environments, they let you know right away that they resent some of the attitudes that people have about their chronic illnesses. But I think one of the things that we really have to understand, in particular with African Americans, you see the disparity in economics, in healthcare. It is really because of the racism that has pervaded our society. African Americans being in slavery for over 300 years and then, given their freedom, promised some reparations that were never received. So they started off behind. They didn't have the wealth. And this lack of wealth, this lack of opportunity for education and for good health care continues generations after generations. When you are denied generation after generation access to wealth, housing, health care, education, this brings forth a society of people that are behind in almost every imaginable area that you would consider available.
You've been listening to Community Rising, Shoreside's Environmental Stories. This podcast is a special project of Shoreside's and Working Narratives. Do you have a story from our coast that you would like to share? Contact us at info@shoresides.org. Thank you for listening.